Welcome to the Gastric Health Show. My name is Dawn Boxall. We have laid the foundation that we are trying to understand why someone is having constipation chronically after gastric bypass, gastric sleeve surgeries, when nothing seems to work. You're using the more fluids, more fiber, and more exercise, and you really didn't get results. Most people are going to feel better physically and mentally if they are having bowel movements on a daily basis. Now, the standard is every 1 to 3 days, but I would say in the functional world, we know the importance of doing it every day. So today's topic, constipation and bacterial overgrowth after gastric sleeve and bypass surgeries. So we are talking about small intestinal bacterial overgrowth, or what we also call SIBO, S-I-B-O, and it's really just where the bacteria is in the wrong location. We're supposed to have the majority of our bacteria in our colon, and sometimes based on certain things that happen in life because of surgeries, medications, different disease states, they allow that bacteria to flow more into the small intestines where we really don't want it. It's normal to have some, it's just the higher levels are supposed to be in the colon. Bariatric surgery is one of those risk factors, and I'm going to break down kind of the differences because there are different types and they usually present with different symptoms. The different types are hydrogen, hydrogen sulfide, and methane. The hydrogen and hydrogen sulfide usually kind of present with diarrhea, and methane is usually constipation. Some people will have both constipation and diarrhea. To explain this a little further, in 2021, in the Journal of Clinical Gastroenterology and Hepatology, they found that 30% of patients with SIBO are colonized with Archaea. And Archaea are just anaerobic organisms that produce methane. So it's not really the bacteria, it's really the Archaea. It could be, if constipation is your main or one of the symptoms that you're experiencing on a regular basis, it could be the methanogens and just really that overgrowth is driving that constipation dominant type of scenario. The key is you got to work with someone who understands SIBO and understands the symptoms, the causes, and kind of how do you treat it. The consequences of SIBO in obese patients before and after bariatric surgery. And what they found is that pre-surgeries, about 15% of obese patients have SIBO already and probably are unaware of it. And then after surgery, they find that that number rises to about 40%. So there are some studies that even go as high as like 86 and 87%. In clinical experience, I would agree. It is somewhere between 40 and 80% of you do experience SIBO. The people who were positive for SIBO after bariatric surgery did have lower weight loss. They do find that the sleeve gastrectomy kind of hold the same numbers and present with SIBO equally, maybe a little less, but in the end, you still have the same risk factors. When you have SIBO, most people are going to have at least 2, maybe 3 symptoms. Some are going to be pretty extreme and others are going to be pretty mild. So it doesn't mean you have it worse or less than someone else. It just means that your presentations are just different and how you are responding is just different. What else could you be experiencing? And that is gas, bloating, belly distension, especially belly distension that gets worse as the day goes on. Some will describe that their belly looks pregnant and feels really distended or really hard to touch and painful. You can also have diarrhea, like we've already talked about, abdominal pain, cramping, nausea, and belching. So those are all symptoms, but there are also the same symptoms for many other digestive problems.